All right, I'm going to give you the best couple minutes about Lyme that you've ever heard in your life. So if you have Lyme, we're going to talk about how to fix that. If you don't just have Lyme, but you have some chronic disease, let's say you have rheumatoid arthritis, colitis, Crohn's disease, ankylosing spondylitis, Parkinson's disease, MS, depression, anxiety, colitis, Crohn's, a variety of chronic diseases. You may also have Lyme as your root cause. Now, everything I can tell you about Lyme as quick as possible. Lyme was created in the 1960s on Plum Island Animal Research Facility, which was a government facility looking for bioweapons and ways to transmit them through vectors like ticks. In 1975 was the first known case that was found of Lyme in Old Lyme, Connecticut. That's where it gets its name. Now, it's really interesting with Lyme because you can be tested negative for Lyme and still have Lyme. Because of the way that the bacterial infection, or spirochete, it's a whipping tail behind it bacteria, it was created, it literally makes it so your immune system is constantly trying to find it, and it keeps evading your immune system. Now, as it evades your immune system, it changes its structure, so it's harder to find. And with the testing that they do, typically within 3 days, if you haven't got the test, you're going to test negative because it's already evolved out of what they're testing for. It's a small amount of tests that they do. Now, doxycycline, the most common thing to treat Lyme with, is a problem. There's literature to show that 100% of the time when you use doxycycline for Lyme disease, you will create persister cells. So within 6 months to a year, you have some other chronic infection. You've already treated you don't have Lyme disease anymore, quote unquote. And so they just say, well, you have this genetic disease. Well, that genetic disease really isn't genetic. It most likely is Lyme disease. You just haven't been tested appropriately for it or treated appropriately for it. Now, within a year and a half to 2 years, we have basically 100% remission on everybody with Lyme. But there's still a problem. Once you treat Lyme and kill Lyme, your immune system has changed. So just like any biotoxin, Lyme is a biotoxin. So is mold, so is environmental toxins, so are heavy metals. So it'll alter your immune response to be an adaptive immune response versus an innate immune response. That will create high levels of inflammation, autoimmunity, and other problems. So you can't just treat Lyme and then say, I'm done, and you still have problems. You go, oh, I guess it wasn't Lyme. No, it was the changes that Lyme made on your immune system. So we can change your immune system over after we kill the Lyme and then alter you back to a normal innate to adaptive balance within your immune system. That tends to knock out all your autoimmune issues. Lyme, doxy is not great for it. Daptomycin and daptosome are. Those are pharmaceuticals. But as far as pill-wise, supplement-wise, Total Pathogen Support's the best thing I've ever seen. You can get it at lifesupporthp.com. It has the studied dose of cat's claw, carvacrol, transresveratrol, curcumin, all those dosages that are shown to kill Lyme. And within a year and a half to 2 years, we kill Lyme on everybody, utilizing that along with some gut support and things of that nature, because obviously if you're killing things, you need to protect your biome. We also have the unique ability, we have some IVs here that can change people's lives within a couple weeks if they have Lyme, and actually have you feeling normal again, which is awesome. However, you still need to continue to treat and eat right and take care of yourself. Lyme is a spirochete, it's a bacterial infection, it evolves out quickly. We can do testing to see definitively whether you have Lyme or not. We can send that anywhere in the country or even out of the country. And you have to treat Lyme appropriately, not just with doxycycline. I hope you guys have a good day. Hopefully that was helpful.